My name's Ed Howard. I'm with the Alliance for Health Reform. I want to thank you for coming. I want to welcome you on behalf of Senator Rockefeller, Senator Blunt, our Board of Directors, to this program to look at health and health care and health insurance in rural America. Now, we know that compared to urban areas, people in rural areas are more likely to be low income, more likely to be uninsured, less likely to have employer-sponsored coverage, which of course is the most prevalent way of getting coverage in this country. We know that geography poses a particular problem to gaining access to needed care in some rural areas. And we know that, just as is in the case of urban areas, that the Affordable Care Act is going to have a major effect on health care access and coverage in rural areas. So today, we're going to take a look at these issues as well as potential policy changes that might address some of the challenges that you're going to be hearing about. And we're very pleased to have as our co-sponsor in today's program the Centene Corporation, which contracts to provide Medicaid coverage in, almost 20 states, and operates a number of related services like nurse call centers and behavioral health. And co-moderating our discussion today, we have Zane Yates, who's Centene's Senior Director of Business Development. Zane, thanks for being with us.
Thank you, Ed. It's a pleasure to be here. And on behalf of Centene Corporation, I'm delighted to join the Alliance for Health Reform and our panelists for today's briefing. Thanks to the Alliance, these briefings allow us to tackle tough health issues such as rural health by increasing our understanding about the federal government, the states, the healthcare industry, and others responding to these challenges. The briefings also provide opportunities to learn about innovative approaches, initiatives that can help improve the access, delivery, and quality of care. And at Centene, we're focused on coordinating health services recipients of Medicaid, Medicare, and our programs to help the uninsured. We're pleased that this is an area of great interest to the Hill staff, as well as the policy, advocacy, and research communities. I'm looking forward to today's discussions and this briefing and the opportunity to exchange views and discuss best practices in rural health. Thank you.
Great. Thank you, Zane. A couple of housekeeping items. There are materials in your packets, including the PowerPoint presentations of our speakers. There's also a one-page sheet of materials that lists all of the written stuff that's in your packets and a bunch of other things, all available online at the Alliance website, which is allhealth.org. If you're watching on C-SPAN and you have access to a computer or another internet device, you can get that same material at allhealth.org. There'll be a webcast and a podcast available next week on our website, and a few days after that, a transcript of the briefing in case you want to go back and relive those exciting words you're about to hear. We'd like at the appropriate time if you would fill out the blue evaluation form that's in your packet so that we can improve these programs for you as we go along. There's also a green question card. Once we get to the Q&A, there are microphones that you can use, and you can fill out the green card and write a question, and we'll try to address it up here. About that evaluation, by the way, normally about a fourth of you take the trouble to fill it out, and we're grateful, and we hate the other three-fourths. But we have a bribe that we commonly do with our colleagues at Centene. If that number rises to 35%, the Alliance is going to donate $50 to support the Healthy Corners project of the D.C. Central Kitchen. Now, that project, which I just learned about, promotes community health by promoting the availability of fresh fruits and vegetables in D.C., specifically in the city's so-called food deserts. So if 50% of you complete the evaluation, we'll go to $100. How's that? So we have, yes, there is a URL at the bottom of that slide in case you want to add your own donation to the one that the Alliance will be making. So that's the end of the commercials. We have a great panel for you. We're going to ask them to give relatively brief presentations, and then we'll open it up for discussion among the panelists and your questions.